Thank you, Madam Chair and members of the committee. For the record, I'm Helen Eby. I live in Auburn, Washington. I'm testing on behalf of Interpreters United, ASME Local 1671, in strong support of this bill. DSHS is attempting to get rid of the affordable medical interpreting testing program that interpreters, limited English proficient patients, and healthcare have been relying on since 1995. This will inevitably lower the quality of interpreting in healthcare settings. Washington State certified and authorized interpreters accurately interpret everything that happens in the encounter, so nobody is out of the loop. This helps doctors make accurate diagnoses and prescribe appropriate teaching. Working with properly qualified interpreters saves over $1,000 per patient encounter. Interpreters need to be tested for all the activities they're called on in the interpreting encounter. The scores need to be set, so failing one section means they have failed the test. Only the Washington State test meets this standard. Having people pass based on only one skill is like giving someone a driver's license when they don't know how to get in and out of a parking space. DSHS is now accepting something even worse, only the written portion of national exams as sufficient proof of interpreting skills. Approximately 80% of applicants pass those written exams with National MBCMI and CCHI, but only half of the ones who pass the written exam pass the oral exam. Accepting only the written exam is like giving someone a driver's license without putting them on the road based on only their score on the written test. These issues put patients and doctors at risk of malpractice. I know a doctor who stopped working at a volunteer clinic because of the low quality of interpreting. My doctor a few days ago told me that an interpreter rendered absolutely everything he said and everything the patient said. This should be the norm, not a surprise. Washington State interpreters do this every time under the current standards. Thank you. This saves money. Thank you for your support.
Hello, my name is Magda Enriquez, and I'm a Washington State certified DSHS medical and social interpreter. I'm here to speak strong support on behalf of SB 5304 and on the impacts of the quality of interpretation services afforded to LEP patients and injured workers in Washington State. I have had LEPs hesitant to work with interpreters in the past because they've had interpreters who were not certified that omitted and left out crucial information and would prefer to rely on a family member. I just recently had a provider thank me for being at an encounter where he was able to communicate and explain more in one appointment than in 3 prior ones due to the quality of language access providers. LEP patient safety and well-being is being put at risk by this watered-down professional standards. This increases DSHS and healthcare providers' liability. Washington State courts are held to the same standard of testing in all 3 areas of interpreting. Why should medical and LEP injured workers be any different? Every LEP, no matter the language, should have a qualified and competent language access provider. Thank you very much for your time.
Thank you. Good morning, Madam Chair, Vice Chair, and members of the committee. I am Con Tran from the Legislative District 17. I am an interpreter for my very first job as a professional interpreter was in 1982. So we are talking about over 40 years now. And I'm one of the first interpreters that was certified by the DSHS in early 90s, and the test was brought to me in Vancouver. That's where I live. I'm also a president of the Interpreters United Local 1671 ASME Council 28. This is a union with over 1,000 interpreters. That means collectively we have thousands of years in experience in this field, and I want to say that we are the best and the most expert, the expert who has the most knowledge about this field. And I'm also a member of the DSHS Language Testing and Certification Advisory Committee. We participate in this committee since spring. And our surprise, we learned about the contracting of the testing. And this is a very, very dangerous move that will affect the health and safety of the most vulnerable and disenfranchised population in the state of Washington. And in the process of talking in the advisory board, DSHS absolutely did not listen to any expert advice from us. And whatever we tried to explain to them, it got brushed off, and they continue to march towards something that I think pretty dangerous practice. Thank you very much.
Thank you very much for being here today to testify.